2026, June 8th, Monday, 4:23 in the afternoon, 100 degrees. Right now I'm at week 15 post-surgery ACL and meniscus. I forgot to record yesterday. I totally forgot. Yeah, it's been busy. Also feel like don't want to do anything, that kind of mood. Decided today, nah, I can't. I would like to keep this going. Maybe just keep this short. Week 15, last week Friday, I did my first physical therapy testing. Long story short, the result is my one leg is almost half weaker than the other leg. So that's quite significant. Imagine one leg is weaker by half. The goal is to be at least, I've seen different kind of numbers, 75, 80 something, 90. Anyway, I am still some ways to go. And just feel kind of lazy, not very motivated to do a lot of things. Yeah, I'll have to figure out this whole situation. Talking about PT, physical therapy, I think I came to a realization. If you are in the US, the medical system, there's a thing called, if you have medical insurance and you usually have providers are in network or not in network. Of course, in network, you get better deal, air quote. So my current physical therapy is in network, and I would assume that most people would do to find something in network because it's cheaper, relatively compared to out of network. That way, it means in network places are more people. That means if you go to in network physical therapy clinic, they most likely have more patients. That means you get less attention from your physical therapist. That means sometimes you kind of wander around and questioning yourself, what the hell? Where is the person that's supposed to watch me? Oh, he's with someone else. Because he has like a 2, 3, 4, 5 patients at the same time. Yep, it's all about money. If you don't have money, you have to go with in-network and to get less care. If you have money, you can go wherever you want. You want the best care, you have one-on-one personal trainer. That's different level. I don't feel like spending that kind of money right now. It's just no. And that's just my little personal observation of how physical therapy works in the US. You just got to find a way to play this insurance game, I guess. And another thing, back to work, still shitty people are still shitty. Yeah, dealing with it. You really want to choke them. Yeah, those people. I don't know. Always have the one or two, the couple that's always shitty people around you. That's it. Just want to vent. Something fun. Last week, Saturday, I went to a abacus class, like an introduction class. Abacus is, in case you don't know, it is old school calculator with beads on it, and you just play with the beads, count, do your math on that. It turned out I have fun doing it. I learned about what's that? Not subtraction. What's the thing called? You add things. What's the word? Addition. That's right. So I know how to do addition on abacus now. And just reminds me of I learned that when I was a kid for I don't remember how long, but not very long, maybe just a few classes. Just reminds me, yeah. And the picture of the week that I'm going to share, this picture I took few weeks ago. Man, I can't remember when. I'll call this picture I Knee You. Knee is the knee, your knee on your leg, that knee. It's my cat sitting on my knee. And it just it tells me during this time, the one of the hardest time, I really need you. I really need something. It's really hard. Every once in a while you get to that low, the bottom, and you feel helpless, frustrated, angry, all kinds of negative feelings. When you want to bang your head to the wall, when you want to punch someone in the face, when you are jealous of people that are doing things that you used to do, that you feel pain when you do certain motion. When you put on the knee the knee pad, the knee sleeve. When you see the scars on your knee, when you just trying to bend down to tie your shoes, to wear socks, when you try to bend down to cut your toenails, when you feel like sitting down, kneel down, sit on your legs. Everything reminds you something you can do. But on the other hand, you try to make you feel better. You say to yourself, at least I'm still here. At least there's still hope to get better. Every day I see stuff on social media, how people share their journey of their knee injury. And yesterday I saw it's a little kid going through ACL injury. Man, I can't imagine that. Why? I hate it so much. Why? Anyway, what else can you do? I just heard my knee popped. That's it for the week. Take care.